Hey everyone, this is Jason Hoffman. Hey, I just wanted to go over some of the basics with Medicare. I know you're getting to the point where you're going to be turning 65, and there's probably a lot of literature that's coming in the mail, a lot of options that are coming at you. So I just wanted to take this time to kind of give you a brief overview on how the different parts to Medicare fit together, as well as what the different types of backup plans would be. Okay. So just to give you a brief background on myself, I've been doing this for about 10 years. The agency I work with, Health Markets, we work with pretty much all the major insurance carriers. We have over 100 national insurance companies that we work with, all the big name brands. A lot of times people will ask me, how much does it cost to talk to an agent or broker? Great news is there's no cost. People like myself get paid on a renewal basis from the insurance companies over time. So it's kind of in our best interest to hopefully find what works best for the insured and establish that ongoing relationship. And we try and help people review their coverage every year. But the great news is there's no cost. It's the same price as if you did it yourself, but we just try and save people a lot of time and hopefully find them the right fit. So I was born and raised in Pennsylvania. Like I said, I've been doing this for about 10 years. Over the course of the 10 years, we've helped thousands of individuals, both in the Medicare space and the under 65 market. So let's kind of get started on what we'll talk about today. So the big thing is there's 4 parts to Medicare, okay? And then you're going to have 2 choices really as far as what your backup plan is going to be, right? Whether that's a supplement or advantage plan. We'll talk about what Medicare supplements are. We'll talk about what Medicare Advantage plans are, touch on prescription drug coverages, and then kind of let you know what are some important dates that you'll have to keep in mind. Okay, so this is a standard book that you'll most likely be getting in the mail if you haven't gotten it in the mail already. It kind of goes through a lot of the differences between the types of Medicare plans that are out there. So the first thing that you want to keep in mind is you want to kind of get down what are the parts that come from Social Security or from the government, right? And those parts are Medicare Part A and Medicare Part B. Now, one of the common misconceptions is that Medicare covers prescriptions. The Part D prescription drug coverage is provided by private insurance companies. And Medicare sets what's called a standard model, okay, which we'll kind of touch on. But Medicare itself does not offer prescription drug coverage, okay? So Medicare Part A, as long as you've worked 40 quarters or paid into Medicare and Social Security tax for 10 years, there's no premium for Part A, okay? And basically, the way that it works, you become eligible at 65 or if you've been on Social Security disability for 2 years. Okay. So with Medicare Part A, there's a per admission deductible, right, that you'd pay when you go into the hospital after each admission, which we'll touch on. And then after a certain amount of time, you start to have daily copays, per day that you're in the hospital. Okay. That per admission deductible is $1,408. Once you get to 60 days 61 through 90, you're going to have a per day copay of $352. And then once you get into the 60 lifetime reserve days, which essentially would be days 91 through 150, your copay would be $704 each day. So you can see there's not any limit on what your exposure could be. If you just had Part A, there's no out-of-pocket maximum. So Medicare Part B. Now there is a premium for Medicare Part B. The standard rate in 2020 is $144.60. There's what's called a Medicare income-related adjustment based on your income. So for example, for a family of 2, if your income is over $174,000, you start to pay more for the Part B coverage. Now, when you have Medicare Part B, that basically covers what they call medical expenses, which are physician services, outpatient testing, labs, therapies, imaging, home health care as well. Okay. And you go to any doctor in the country, or facility in the country that accepts Medicare. So you have there's no network because you have broad access, meaning you can go anywhere that Medicare is accepted. So there's a standard deductible. Like again, let's say you just had Medicare Part B and Medicare Part A by itself. With Medicare Part B, you have a standard $198 deductible here in 2020. Once you satisfy that $198, then Medicare pays 80% and you'd pay 20% for Medicare covered services. Now, there is something called excess charges, which you see here. So now excess charges, there's 8 states where they can't bill excess. Physicians can't bill excess. And we can touch on those. The doctor can bill in excess of 15% of what Medicare would pay. So let's say Medicare pays a doctor $100, okay? Then the physician technically could bill $115, and that $15 would be billed to the patient as excess. So again, there's 8 states where it's against the law. It's called Medicare Overcharge Measure Law, or nickname is the MOMS Law, where they can't bill that. And in states where they do, like in 2019, the national average was it happened about 5% of the time. Okay, now that's not to say that that may not become more prevalent in the future if reimbursement rates to physicians go down. Okay, so with Medicare, you have Part A and Part B, which come from the government, right? And then these 2 different types of backup plans, if you want to think of it that way. One's called Medicare Supplement, and the other is called Medicare Advantage, which we'll touch on. So it's important to know that when you have a Medicare Advantage plan, the insurance company is taking over as primary payer from Medicare. So what that means, when you go to the doctor and you have a Medicare Advantage plan, you don't give them your Medicare card, you give them the insurance company's card. And that's significant because then you have to make sure that you're within that specific network of physicians and providers and facilities when you have Medicare Advantage. Medicare Advantage plan often includes the medical and the drug coverage in one plan, okay? Whereas when you have a supplemental plan, Medicare remains primary payer. So what that means, when you go to the doctor, you give them your Medicare card and you give them your Medicare supplement card, okay? The Medicare supplements do not include prescription drug coverage, okay? Now, when you do have a Medicare supplement, you just have to, a lot of times people ask me, well, do I have to worry about, does my doctor take this plan? And the answer is no, because as long as the doctor accepts Medicare, the supplement will pay what a Medicare approved service would be. Okay. So some important facts to know: when you have a Medicare supplement plan, you have to have A and B, and that's also going to be true for Advantage. Okay. You're going to pay your monthly Part B premium regardless of what type of backup plan you get, whether it's a supplement or Advantage plan. Okay. They don't include the drug coverage, and the costs vary by company for the same plan type. So what that means, like, for example, there's a supplement plan called Plan G. Every company that offers Plan G, the coverage is exactly the same, but the initial rate may differ. More importantly than that would be the how the insurance company raise rates over time, the rate stability. A lot of times when you have a new carrier that comes into the market, they'll give you the lowest rate because they have to obtain members, right? Once they hit their enrollment number, then those prices can start to jump up year over year at a higher rate than some of the more stable carriers, okay? So when you're looking across the board at all these different companies that have Plan G, you're like, why are the prices different? And again, part of it is how they rate the plans. You know, some are called attained age rating, some are community rating, but a lot of it is the stability of the carrier. Some companies have gender rating, you know, where they give different rates for male and female, okay? So I always tell people, more important than the initial price is the rate stability. Okay, when you're first turning 65, you have what's called an open enrollment period, where you can get a Medicare Supplement plan without any questions asked. There's no health questions. Okay, so again, you have open access. There's no network. You can go anywhere in the country that Medicare is accepted. Okay, so and before, when I was saying that every plan, like every Medicare Plan G, for example, is the same, it's because they're standardized policies. And those, they may vary by state, which state offers the certain letter types of plans. Okay. And again, it's important to know that the different carriers can charge different premiums for the exact same coverage. Okay. So this gives you a quick little overview on all the differences. I mean, we're not going to get that deep in the weeds for this discussion. You know, the most comprehensive Medicare Supplement plan, you could say, is Medicare Supplement Plan F, which is actually no longer offered to people that are new to Medicare going forward if they're just turning 65. Now, if somebody's over 65 and is new to Medicare, that's a different story. You may still be able to get Plan F as well. It's not something that I typically recommend, because if you think about it, you have a shrinking risk pool with Plan F, which means, you know, when you don't have as many insured people to spread the risk across, you know, there's a higher tendency for the rates to go up over time. Okay, so the most common recommendation or most comprehensive plan, you could say, is Plan G. Now, I just wanted to point this out because a lot of times when you're looking at the summary of benefits, it's kind of confusing. Well, what do I pay? So you always want to look at the column that's on the far right that says you pay. So for example, this shows you Medicare Supplement Plan G, what it picks up from Medicare Part A. So before, you know, when we were showing the potential limits on the number of inpatient days that Medicare Part A covers, when you get a Medicare supplement, it adds a year to those lifetime reserve days. Okay, so then you have basically a year and a half of lifetime coverage. And this plan, as you can see, it covers all costs for inpatient stays. Now, with skilled nursing, one thing to be aware of, for skilled nursing to be covered by Medicare, it has to follow a 3-day inpatient stay at a Medicare approved facility. Okay, or 3-day inpatient hospital stay, basically. And then the supplement would pick up all your cost sharing for the first 100 days of skilled nursing. You can see where it says here all costs. That's if it ever exceeds 100 days. Because Medicare only covers up to 100 days of skilled nursing. So there's nothing for the supplement to supplement at that point. Okay? And then you can see for blood, hospice, there's no cost to the insured person. Okay, where we jump over here to what the supplement picks up from Part B covered services, you can see you have that standard $198 deductible. So when you go to the doctor for the first time, when you're on Medicare, for like, let's say it's a sick visit, for example, you wouldn't pay anything right then and there at the doctor. The doctor would bill Medicare, and then Medicare would say to the doctor, well, since you agreed to take Medicare assignment, you've agreed to our negotiated rate of, let's say, for example, $47 for a doctor visit, then you get that bill in the mail, and you would pay towards this $198 deductible until you hit that. And then once you hit $198, all Medicare covered services beyond that point you would not have a cost for. That's where it says 0. Now, the Part B excess charges that we touched on, so Plan G does cover excess charges. So again, there's 8 states where you don't have to worry about that. Pennsylvania is one of them. But in the states where physicians can bill excess, you don't have a cost for that. Okay, blood transfusion. You see this deductible listed again here for blood transfusion and home health care. It's the same deductible as the deductible listed up here. So for example, if I already hit my deductible from going to the doctor, I don't have to pay it again if I need you know, blood transfusion or if I need home care. Okay. All right, so just to kind of recap here, with original Medicare, the 2 parts that come from the government are Medicare Part A and Part B. Okay, when you have the different types of backup plans that you can choose from: Medicare Supplement, Medicare Advantage plan. It's important to know when you have a Medicare Advantage plan, the insurance company takes over as primary payer from Medicare. Okay, so then when you go to the doctor, you just give them the insurance company's card. They often include the drugs and the medical in one plan. Okay, when you have a supplement, or your Medicare remains primary payer. When you go to the doctor, you give them your Medicare card, and then you give them the insurance company's card. And when you have a supplement, your Part D coverage is separate. Okay, so typically with Medicare Supplement, you can go to, you have much broader access, you could say. You could go to any doctor or facility in the country that takes Medicare. With Advantage plans, and this differs based on what area you live in. Some have more local networks. Some may still have broad networks. There are some Medicare Advantage plans that are quite good as well. Okay, so well, we can touch on an example of an Advantage plan. So you'll see that the costs are all over the place with Medicare Advantage plans, right? So, you know, premiums ranging from $0 to $98. And oftentimes people say, well, how can they charge $0? Well, what's happening is Medicare is subsidizing these plans. They're basically paying the insurance company to take over all the billing, claims processing, and administration of the coverage. Okay, so they're actually subsidized based on enrollment numbers that they get. So that's how they can charge $0. Usually when you have higher plan costs, it could be for a number of reasons. Could be broader network. It could be a more expansive drug formulary. You may have a lower out-of-pocket limit than what you would see on some of the lower cost plans. Okay. The prescription drug coverage. So with the prescription drug coverage, you're usually going to see there's a wide range of choices. Okay. Now, before, when I mentioned that Medicare does not cover prescription drugs, but they set a standard model that the insurance companies have to go by, because the drug plans are, again, offered through private insurance companies. Okay. So oftentimes you will see that they have an annual deductible, you know, that can be up to $435. Usually that deductible is waived for tier 1 and 2 drugs, which may include generics. Some generics could fall into higher tiers. So just so you're aware, some plans may have a 5-tier formulary, and you can see a generic fall into one of those higher tiers. Okay. The drug deductibles and the benefits overall work off a calendar year deductible. Okay. And the difference across these plans is the deductible, the tier structure, and usually the formulary. Okay. So, you know, each tier, you'd have a different copay or a co-insurance associated with that tier. Oftentimes you'll see what's called prior authorization or quantity limits. Prior authorization meaning that, you know, the doctor usually has to authorize a certain prescription, saying it's medically necessary. The company may impose certain quantity limits. Sometimes you could see that on narcotics, for example. And step therapy may be required. Step therapy is when they want you to try a lower cost alternative before they approve a more expensive prescription. Okay, some important enrollment dates to keep in mind for Medicare Part D and Advantage. Okay, so your Part B effective date, let's say when you're turning 65, is going to be the first of the month of your birthday. Now, if your birthday falls on the first of the month, depending on how many days were in the month preceding the month of your birthday, you know, like for example, let's say somebody's born on March 1st. Well, there's only 28 days in February, unless it's a leap year. They will actually make your effective date February 1st. But if you're born on the first of the month preceding has 31 days, then they're not going to bump your effective date up by a month. Okay. So you can apply for Part B 3 months prior and 3 months after the first of the month in which your birthday falls. Okay. So Medicare supplements, you can apply 6 months out. before your Part B effective date. Okay, so you know, and sometimes that is beneficial because you can potentially lock in a rate by doing that. Okay, and again, when you're first turning 65 or you're first getting Part B, there's not going to be any health questions. You have what's called an open enrollment period. Okay, so how can we help? When you're going on the Medicare, I mean, there's a lot of trees that die, unfortunately. You get a stack of papers in the mail, and a lot of times it can be confusing. It's confusing for agents that are first getting started in this. So you can call a bunch of different places, or you can call one place, because we work with all the nationally recognized carriers, and you can let us do all the heavy lifting for you. Because our goal, again, is to identify a plan that is going to work best for you. We don't charge any fees for our service. We get paid by insurance companies, which again is the same. You pay the same price no matter how you do it. So we save people a lot of time. Okay, so how you can get a hold of us, you can simply call 484-209-1558. You can find out more about me on my website, jasonhinsurance.com. Okay, or you can just Google Jason Hoffman Insurance. We'll be more than happy to help you, or simply answer any questions that you have. Okay, if you need somebody to help you walk through the process, we're here to do that. If you just need a question answered, that's fine too. Okay, hope you guys have a great day, and we look forward to speaking with you.